This 13 Friends for Life segment is sponsored by the Comprehensive Breast Centers at Mercy Health. Being a woman and getting older, those are the two biggest risk factors for breast cancer, but there are several other risk factors to consider. Kelly Jensen is a physician assistant from the Mercy Health Comprehensive Breast Center in Muskegon, and she is here to talk about the risks associated with developing breast cancer. Good morning.
Good morning.
Okay, so being a woman,
yes,
is one.
It is.
Of a multitude of them, getting older being the other biggie.
Yes.
There are others though,
yes,
right?
we can't avoid those first two, but
Yeah.
the third is a family history of breast cancer. And it's not just a family history, it's how young those relatives were as well as how close they are to you, like a mom or a sister or an aunt.
I think I understand that you also have to consider their age and yours as to whether or not you know, when you need to start worrying about your own health.
Exactly. I mean, if you think about it, when a woman is 20 and her mom may be in her 40s, there may not be a huge picture regarding cancer in the family.
Yeah.
But if you progress 15, 20 years down the road and reassess that risk, it may be a completely different picture because as we age, we do see different ailments that come across.
But some pictures will be crystal clear, right? If your mother at a young age developed breast cancer, you know you need to also be vigilant younger.
Oh, absolutely. You know, most of the time we want to start screening a relative about 10 years before their youngest relative was diagnosed, just to be safe. Sometimes it's even earlier, and then we also may implement different types of screening.
Yeah. So talk about what a woman who knows she's at high risk, what she needs to do to remain vigilant.
Well, certainly, be breast aware, self-aware.
What do you mean when you say that?
There's different, schools when it comes to self-breast exam versus breast aware. It's just basically knowing your body, knowing what's normal for you, and then being able to identify if something's a little bit out of the norm for you.
Okay, so be self-aware about your breasts. What else?
Mostly just pay attention to your family history. It seems that so many families don't talk about family history, and you want that information often when it's too late to ask those people about it. So ask and go into detail, who had what, instead of it being, just a female cancer. Well, what type? Be as specific as you can. Ask those pertinent questions to your family members.
Yeah, I also say always it's about a relationship with your physician too, so that you're kind of in a partnership for this as you walk through.
Absolutely, absolutely. Most of the time your primary care physician is going to be asking those questions, but never hesitating if you have questions, asking it of them as well.
Yeah. Okay, so you are a high risk coordinator with the Risk Plus program.
That's
what
right.
does all of that mean?
That simply means that we have a specialized program to specifically look at family history pertaining to cancer and doing some detailed risk assessments, and those are using national models, data, right? Using a bunch of data and then looking at national risk models, and then based on what risk is, making recommendations that are in accordance with our national guidelines.
In other words, applying other people's experiences to each patient to identify whether they fall into that risk category and treat them appropriately because of it.
Yes, and that's all a risk model is. It took a bunch of data points from what people had in common and then trying to use that same data to predict risk.
Yeah, learning from other people's experience for the good or the bad, right?
Yes, that's true.
Okay, well, if you would like to learn more about the Comprehensive Breast Centers at Mercy Health, you may do so on their website. Go to WZZM13.com. You'll find a link to it right there. And don't forget to call your friend for life today. Remind her to do that important breast self-exam. We'll be back.